Health insurance coverage is an important measure of our nation's overall well-being. Whether it's illness, injury, or preventative needs, health insurance provides greater access to medical care, protection from high unexpected costs, and more economic stability. Each year, the Census Bureau provides data on health insurance coverage. We look at who is and isn't covered, where they live, and what type of insurance they have. Policymakers use this information to make data-driven decisions. The health insurance estimates released today come from two surveys. The Current Population Survey Annual Social and Economic Supplement asks people about their health insurance coverage at any time in the previous calendar year. Most of the national level results presented today come from this survey. The American Community Survey asks people about their coverage at the time of the interview. Due to its larger sample size, the American Community Survey is the recommended source of health insurance statistics for smaller populations and levels of geography. Let me begin by summarizing the main findings this year. An estimated 8.8% of the population, or about 28.5 million people, did not have health insurance coverage at any point in 2017. The uninsured rate and the number of uninsured in 2017 were not statistically different from 2016. Between 2016 and 2017, the percentage of people uninsured at the time of their interview decreased in 3 states and increased in 14 states. In 2017, most people, 91.2%, had health insurance coverage at some point during the calendar year, with more people having private health insurance, 67.2%, than government coverage, 37.7%. Looking at subtypes of health insurance, employer-based insurance was the most common, covering 56% of the population, followed by Medicaid, Medicare, direct purchase, which includes health insurance exchanges, and military health care. The larger sample size of the American Community Survey allows us to observe characteristics in greater detail. And because the survey asks about current coverage, we have the opportunity to examine how health insurance status varies by single year of age. In 2017, 26-year-olds had the highest uninsured rate at 17.8%. 3 notable sharp differences exist between single-age years, specifically between 18 and 19-year-olds, between 25 and 26-year-olds, and between 64 and 65-year-olds. These differences correspond to common age-related eligibility thresholds for coverage, including CHIP, dependent coverage, and Medicare. Over time, changes in the rate of health insurance coverage and the distribution of coverage types may reflect economic trends, shifts in the demographic composition of the population, and policy changes that affect access to care. Several such policy changes occurred in 2014, when many provisions of the Patient Protection and Affordable Care Act went into effect. This chart shows the change in percentages of people with health insurance coverage between 2016 and 2017 on the left, and between 2013 and 2017 on the right. The percentage of people covered by any type of health insurance for at least some time during 2017 was 91.2%. Starting with the left side of the chart, we see that the overall coverage rate is not statistically different from the rate in 2016. Between 2016 and 2017, the rate of Medicare coverage increased by 0.6 percentage points to cover 17.2% of people for part or all of 2017. This increase was partly due to an increase in the number of people aged 65 and over. The military coverage rate increased by 0.2 percentage points to 4.8% during this time. Between 2016 and 2017, there was no statistically significant change for any other subtype of health insurance shown here. Moving to the right side of the chart, we see the change in health insurance coverage rates since 2013, the baseline year before many provisions of the Affordable Care Act went into effect. The uninsured rate decreased by 4.5 percentage points between 2013 and 2017. The rate of private coverage increased by 3 percentage points in this period. Of the 2 subtypes of private coverage, Only direct purchase health insurance significantly changed. During this period, the government coverage rate increased by 3.2 percentage points. The coverage rate increased for all of the subtypes of government coverage: Medicare, Medicaid, and military health care. Variation in the uninsured rate at the subnational level may be related to whether the state expanded Medicaid eligibility as part of the Affordable Care Act. This chart categorizes states into two groups: those that expanded eligibility and those that did not. 31 states and the District of Columbia expanded Medicaid eligibility on or before January 1, 2017. 9.4% of the population aged 19 to 64 living in expansion states had no health insurance coverage at any time in 2017, not statistically different from the percentage in 2016. In non-expansion states, 16.7% of the population had no health insurance coverage during 2017, up from 16.1% in 2016. In both expansion states and non-expansion states, the uninsured rate for working-age adults in 2017 was lower than in 2013. While it is useful to look at the states grouped by expansion status, there's more to the story. The American Community Survey allows us to examine uninsured rates at the state level. On this map, the darkest blue shading is applied to states where the percentage of people uninsured at the time of interview was 14% or higher. Lighter shades represent lower uninsured rates, with the lightest blue category representing an uninsured rate of less than 8%. Two states, Oklahoma and Texas, are in the darkest shade of blue for 2017. And 25 states and the District of Columbia are in the lightest shade of blue. This map presents the change in uninsured rates. Between 2016 and 2017, the percentage of people without health insurance coverage decreased in 3 states and increased in 14 states. Statistically significant decreases ranged from 0.2 to 1.9 percentage points, and increases ranged from 0.3 to 1 percentage point. More information is available in our reports and online.